Quinn, thank you so much for reviewing your medical history with me. I noticed that you vape. Are you open to discussing that further?
Yeah, I used to smoke cigarettes, but I switched to vaping because I heard it was better for me.
Congrats on quitting cigarettes. That's a really great accomplishment. Can you tell me what you enjoy or like using about the vaping?
I feel like it helps me relax and it's a great social activity for me.
That's a great thought. It sounds like you really care about your health, but that you also like the social aspects that vaping brings you. Did you know that vaping can still cause some negative effects to your overall and oral health?
No, I've actually never heard of that. I've always heard that it was like a healthy way to quit smoking.
There have actually been some recent studies that have come out to talk about the negative effects of vaping. Would you like to learn more about that?
Yeah, I'd be down.
Recent studies have found that smokers who use e-cigarettes for more than a year actually have a harder time quitting and are more unlikely to quit than smokers are.
Wow, I didn't know there were a lot of studies that came out saying that.
That's totally understandable. E-cigarettes can also be bad for your oral health and overall health. Would you like to learn more about that?
Yeah, of course.
E-cigarettes still contain nicotine, which is a highly addictive substance. It'll keep you addicted to the act of vaping. In addition to that, vapes have other chemicals that can be cancer causing, and then the flavorings are also harmful to your lungs. And it also has some heavy metals that can be harmful to your overall health as well. And since you're breathing in through your lungs, it is directly affecting your lungs, and then it can also affect other parts as it's absorbed. Quitting vaping and smoking can be the best thing that you can do for your overall health and your oral health as well.
Wow, I didn't know vaping would still be bad for my lungs. All I heard was that it could be better. And you also mentioned that it could be bad for my oral health. Can you tell me a little bit about that?
Nicotine has a bad effect for your oral health. It actually suppresses your immune system, so it makes it harder for your gums to heal. This puts you at a higher risk for conditions like gingivitis and periodontitis. You also have twice the risk for developing gingivitis or periodontitis when compared to a non-smoker.
Oh, okay. I've heard of gingivitis before, but I've never heard of periodontitis. Can you tell me a little bit about that?
Gingivitis and periodontitis are both what we call periodontal diseases, so diseases of the oral cavity. One of the main differences between them is that gingivitis is reversible, while periodontitis causes irreversible damage to the tissue that supports your teeth. Once you're diagnosed with periodontitis, it involves lifelong management to help to try and halt additional tissue loss. This can include cleanings such as scaling and root planing. So we will actually scale below the gum line on your root surfaces and make sure everything is cleaned off. There are also surgical procedures like gum flaps or bone grafts.
I had no idea that my gums and my bone could be permanently damaged like that. I absolutely don't want that happening to me or having it progress any further. And also, I want to keep my lungs as well because I love staying active.
It's great to hear that you care about your overall health. Quitting smoking or vaping is one of the most important things that you can do to improve your overall health. After learning more about vaping today, would you be interested in quitting?
So after hearing what you had to say about vaping and smoking, yeah, I think I'd be pretty interested in trying to quit. And I'm not sure where to start though. Vaping was a gateway to quitting smoking.
That is completely understandable. You don't have to quit vaping on your own. I'm here for you if you have any questions, and I can also give you some resources that you may find helpful through your process of quitting. Would you like to see them?
Yeah, I would love some.
Many resources available to you that can help you quit vaping. I'll give you a few, and then you can review those resources at home and you can decide what works best for you. The first one is a quit line. It's a number that you can call and they can talk with you on the phone. email you some resources, or mail you some resources depending on what you prefer. One of the quit lines that you can call is 1-800-QUIT-NOW, and you can also text them if you'd like. The CDC also has a website with tobacco cessation information. And then lastly, there are some tobacco cessation support groups that you can join, where you can actually go and talk with a group of people who are also in the same position as you, and there's someone to help everyone guide through the session.
Okay.
Would you like some help with maybe figuring out some coping mechanisms to quitting vaping?
Yep. Yeah, sure. I'd love to talk about some coping strategies.
Sounds great. To start, are there any triggers that you're worried about for quitting tobacco?
Yeah, I'm actually pretty worried about anxiety, and my friends also vape, so I'm also worried about the fact whether I fit in or not with them after this.
I understand anxiety and losing the social aspect of vaping can be really big triggers. As far as coping with anxiety, there are some other mechanisms that you can use to cope with anxiety, such as exercising, contacting friends for some support, and then chewing sugar-free gum has been found to be helpful in some people. And then as for your friends, I don't know if you have a couple friends who don't vape, but you could try to hang out with them a little bit more while you're quitting, or you could ask your current friends who do vape to just not vape while you're hanging out with them. They might be more open to it than you think. What do you feel about the coping mechanisms that we just discussed here?
Oh, speaking of exercising, I do love to exercise, and that could actually help with my anxiety, so I think I'll try exercising more. And as of recently, I do have a couple of friends that I've been meaning to reconnect with that don't vape, so yeah, I could try to connect with them more.
Thank you for discussing this with me. After this discussion, how are you feeling about quitting now? And are you interested in setting a quit date?
I feel better, a little bit better about quitting now, and I'll definitely take a look into those resources you sent me. As for the quitting date, I think, yeah, I'll think of a quit date, and I'll let you know. Yeah, that'd be great.
I'm proud of the progress and everything that you've learned today. Quitting is a really big step, and I'm here for you. If you have any questions, feel free to call the office. When at your last dentist appointment about 6 months ago, you mentioned that you were thinking about quitting. I was just wanting to check in on that and see how you're doing with that.
I'm actually feeling great. I quit 5 months ago.
Oh, congratulations. I'm so proud of you. That is a huge step. Do you feel like you have any challenges?
Sometimes I feel like having a vape again, and a lot of the times that I don't have the support I need to be able to stop vaping.
Oh, that's totally understandable. Having support right now is really important for you. I'm happy to provide you with some resources for getting some support. For example, the 1-800-QUIT-NOW helpline can help you connect to some free coaches, and they can offer you some extra support when you need it. It's completely normal to feel like you want to vape again. A lot of people experience this, so don't feel alone. I'm really proud of all the progress you've made. Congratulations, it's a really big step. If you'd like, we can schedule a follow-up visit or just a phone call to check in and see how you're doing with your cravings and see if you need any extra resources or support.
I really appreciate all the encouragement and the resources you've shared with me. Although it hasn't been easy, I do feel better after quitting smoking for 5 months. Last time you mentioned to me a hotline, but I didn't really follow through with that. But I feel that now is an appropriate time that I should be able to call them, because it would be nice to have somebody on the other side supporting me and being able to talk to. And of course, I'd like to schedule a follow-up appointment for you, so that we can continue talking about my oral health and how I can, stabilize my periodontology.
All right, here you go.
Thank you.